Welcome. I'm speaking to you from the sanctuary, home of the New Testament Assembly, the church where no one stands alone. It is at this time of the year that we would gather right here in the sanctuary for our annual Black Mental Health Conference, Healing Our Broken Village. But as we all know, this past year has been quite extraordinary. And many of us still remain shielded at home, others are reluctant to venture out, and many more are struggling to make sense of the changes while trying to get on with their daily lives. Our annual conferences have always been a space where we come together to celebrate our togetherness, our diversity, and to express our determination to address the inequalities that exist in mental health services. We have taken the decision to postpone this year's conference as a live event and to hold it when we are able to come together again. In lieu of our conference this year, we want to share with you some of the work that we have been doing through this short film and to update you on our progress. I would like at this time to invite Director of the Wandsworth Community Empowerment Network, Malik Gol, to share with you some updates.
Thank you, Bishop. It's great, of course, to be here at the church again, empty this year for our conference, but we were very keen to give an update on the work that we've been doing over the last 12 months. And of course, over the last 12 months, it's been a difficult time. We've had the COVID pandemic, which we're still living through. For me and for many of us, the Black Lives Matter movement was probably the most significant event this year, where it amplified the injustices and inequalities that have been experienced by our Black communities. So we were very keen, even though we were not having a conference this year, for us still to give an update to our participants and our communities about the work that we have been doing, and specifically around the Ethnicity and Mental Health Improvement Project. At last year's conference, many of you will know we achieved a major breakthrough where we launched the Ethnicity and Mental Health Improvement Project, MHIP, securing a long-term commitment from the Chief Executive Officer, David Bradley, and the local mental health trust, South West London and St George's, to work alongside us and our communities to make a real difference in reducing mental health inequalities. At the end of our conference last year, October 2019, we established an expert advisory panel. This included Professor Frank Keating from Royal Holloway University of London, Melba Wilson, an independent expert and highly regarded in the field of mental health, Dr. Rochelle Burgess, Deputy Director of Global Mental Health at University College London, and Professor Sashid Haran of the University of Glasgow to act as lead consultant to the project. I'm pleased that the new Chief Executive Officer of our local mental health trust, Vanessa Ford, has picked up the mantle from her predecessor and continues to help lead the charge and transformation, and in a normal year would have been at the conference here on this platform as she was last year. Nevertheless, she was keen to join us, and I would like to welcome her. It's been a difficult year so far. Could you just tell us about some of the challenges that you've experienced at the Mental Health Trust?
So I think it's been a difficult year for the Trust. I think it's been a more difficult year for the community. But actually with that, there's been some really good parts. I think the Trust as a whole has coped really well because of the support that we receive from our staff, the support we receive from our patients and the patients and our patients' carers. The pandemic has hit everybody in different ways, and no more so than highlighting the huge inequalities that we've had. But actually, as a trust, the grounding work that we've put in, I think has paid dividends. So the relationships that we've had with each other have really led to us being able to continue to deliver good care.
And in the last year, of course, you were here with us on this very platform.
I was.
And we launched the MHIP project.
Yes.
Which we're very excited about. How have you seen the MHIP project evolving and going forward?
Many organisations, as a result of COVID, have drawn attention to the inequalities and started doing some work. But for our trust, I think it's different. The reason I think it's different is we made the commitment to doing this work years ago. So I think this is our 12th year of Healing Our Broken Village. So that's 12 years worth of commitment. I made a promise that we were going to do something with the community that was going to really help heal the inequalities and move forward together as a community. And the reason we as a trust want to do that is because it's the right thing to do. It's no more complicated than that. It's the right thing, and it's not right that there's a disproportionate number of people from black and ethnic minority groups who are detained. That's just, it's not right. It's not right that that's been the case for the number of years it has been. But I do believe that the MHIT programme is one of the answers to healing that gap, to bridging that gap, for people getting support in the right place. And we need to modernise mental health services. So in many ways, if I look at some of our other types of healthcare, mental health services are quite forward-thinking, but they're not forward-thinking enough for the communities that we serve. And we need to continue to do that work.
And one of the things that we wanted to do with MHIP is actually use places like this church as a place for early help. I mean, what's your thinking around that kind of idea of having mental health community embedded services in places like the church?
Well, gosh, listen, this time, 9 months ago, 9 months since March, I would never have thought we would be providing the volume of care that we are on digital platforms. We would have said it was impossible to do. I think COVID-19 it has been hugely impactful on many different layers. But if there's one positive, it's shown us that we could do things in a different way. And I think using community hubs, so using churches, using homes, using areas which people feel are more them than us, it makes perfect sense. Why would we not do that? And at the same time, we all know that Springfield Hospital is not going to look like Springfield Hospital soon. I think alongside the MHIP programme, we've started our massive estates modernisation programme, and that is all about integrating with our local communities. So we have to do this together.
Thank you.
Hi, Rosanna. Welcome to our Healing the Broken Village conference, which this year is on film. And I'm very pleased that you're able to join us.
I'm so excited to be here, and as you will know, I am a big fan of all of the work that WCEN does, and I'm really, really proud and honoured to be a part of it. So thanks for having me.
Thank you. And I know from your role as local Tooting MP, but also as a spokesperson for mental health, what's your view, Rosanna, very much about COVID-19 and its impact on BME communities, which we know has been grossly disproportionate?
As far as I'm concerned, the COVID-19 crisis has laid bare the inequalities that have already existed within our communities. You know as much as I do, if not even better, that inequalities that are facing our BAME community mean that when it comes even just traditionally to access to healthcare, to mental health support services, it is very difficult. But during this COVID-19 period, we have seen our BAME community members often scapegoated for spreading this virus, but also we have seen disproportionately a greater number of deaths within our communities. And I think that has been for a number of reasons.
This issue, of course, is not a new issue.
No.
BME inequalities has existed on the record for about 30 years. We've had judge-led inquiries, we've had government reports delivering race equality. I mean, it's a long story of inequalities. Why do you think that we have been unable to tackle that over such a long period of time?
I think there hasn't been the political will to. I think if you look generally at the people that lead our country, the people that advise the people that lead our country, we're still not seeing proper representation. We're not seeing true representation that is reflective of our communities, whether it comes to ethnicity, socioeconomic background. And we know as well that when we look at things like mental ill health, if you're a young black man, you are more likely to be first diagnosed with mental ill health when you've already entered the judicial system than before you go into it. And so these things are, quite frankly, everybody's problem. And we need to get away from the narrative that it only affects you if you're from the BAME community. We need to make sure that everybody sees this as their collective responsibility. It shouldn't just be a problem if you are from a Black and Asian population. We need to stand up for everyone that lives within our communities.
You know about our MHIP project, Ethnicity and Mental Health Improvement Project, and you've been such a big fan of our work over so many
Huge.
years. We're very pleased that the core of the project is in Tooting, which you're our representative for, Mushkil Hassan, Gatton Road Mosque, New Testament Assembly Church. The whole idea of the MHIP project is that we enable these frontline communities, our pastors, our imams, our community leaders, to do the early intervention and prevention care, and we invest them to do that. You know these communities very well, Rosanna. What's your view about the MHIP project and how we want to go forward?
The project is phenomenal. But what I would say as well is that it shouldn't just be reliant on projects. You must be supported at every level. You should be supported by your community representatives, such as myself, and I'm very proud to support you. You should also be supported by central government, and you should also be supported by the council. We have a global responsibility, and you know, it takes a village to raise a child, doesn't it? And in your initiatives, in the work that you're doing, bringing everyone together, regardless of colour, regardless of religion, empowering people to be the change they want to see and to support those in their communities, it's just simply phenomenal work. But it's not good enough to be done in isolation. It has to be done with support from absolutely everybody at every level. And as the MP for Tooting, as someone who's born and raised here, as a member of the BAME community, I pledge my support to you wholeheartedly. And I thank you for the work that you're doing, because it makes such a difference. And I know that Mushkil Hassan provided so much support for my family during very difficult times. You know, with my father who had dementia, I was in tears on the phone to Naseem on many occasions, and the support and the love that she gave was just phenomenal. So on a personal level, I'm so grateful, and I understand the importance of your work.
A new delivery group has been set up to roll out MHIP over the next 12 months and implement our key interventions. This includes community-led mental health and well-being hubs with community-embedded workers, increasing service options through crisis residential alternatives, enhancing support for people with long-term mental health needs, and specialist support for those subject to multiple Mental Health Act admissions, reducing restrictive, coercive practices through inclusive and shared decision-making, eliminating the use of restraint and control, enhancing inpatient care experiences through community involvement in inpatient care and cultural mediation, and ensuring a culturally capable workforce through supporting the development of culturally informed clinical practice and organizations that are capable of serving culturally diverse communities. Please join us. Visit our project website on www.mhip.co.uk. We look forward to seeing you again at our forums, at our meeting spaces, and at our next conference as soon as we are able to do so.